Welcome to the physiology of the gastrointestinal tract again. This is the second part of the talk on the motility patterns in ruminants. In the previous lecture, I talked about the different parts of the ruminant stomach, and we said there are four parts: rumen, reticulum, omasum, and abomasum. I also mentioned that based on the structure of each of these parts, they accommodate certain functions. For example, the rumen has a lot of villi, which increases the surface area for microbial digestion. The reticulum is honeycomb shaped, which entraps the large particles and foreign bodies. The omasum contains lots of leaves, which basically works as gastric emptying in the other animals for the sieving effect to absorb bicarbs and volatile fatty acids before the food gets into the glandular stomach, which is the abomasum. I also talked about how does the food go into the GI tract of the animal, and how does it come back to the mouth. I said there are two circles. The first one goes from the mouth to the rumen, to the reticulum, and then to the mouth again. And then the second cycle goes from the mouth to the reticulum, omasum, and abomasum. Two paths for the food. Now, I also mentioned that when we open the stomach of the ruminants, we will find two distinct structures: pillars and ruminal sacs. Pillars work as chemoreceptors and also as stretch receptors. They sense the amount of food, the size of the food that's coming, and also they sense the pH and the chemical structure, if you will, of the food. I also mentioned that the motility patterns in the ruminant stomach happen in two cycles: rumino-reticular and omaso-abomasal. Rumino-reticular and omaso-abomasal. The oral and the esophageal motility patterns in ruminants are similar to other animals. No difference. The last thing I mentioned is that the motility patterns are primary contraction and a secondary contraction. The primary contraction causes mixing, and it separates the food particles based on their size into two zones: a slurry zone with large particles and zone of potential escape as small particles, and a secondary, which is eructation of food, motility cycle, if you will. And with this, you will separate the food based on specific gravity into a gas, solid, ejection, and liquid zones. And we've talked about how does the food move. First, in the primary mixing contraction, which basically you have reticular contraction and then dorsal followed by ventral caudal contractions of the ruminal sacs. Then cranial contraction of the dorsal, then followed by a cranial contraction of the ventral ruminal sacs. This will basically mix the food and break it when it happens for long period of time, just like the reservoir in the other animals. After that comes the cranial contraction of the dorsal sac with the relaxation of the ventral sac and the elevation of the cranial pillar, which pushes the food, basically, the slurry zone to be very specific, into the um, esophagus. When it reaches the mouth, the tongue expresses or separate the molecules from each other. The tongue works as the separator of the molecules. So the water gets swallowed again. The large particles go back again to the slurry zone in the rumen, and the small particles go to the zone of potential escape, to go to the reticulum. Today, we will continue on these motility patterns. And that is basically where the zone of potential escape, which are the small particles, as I mentioned earlier, move from the rumen to the reticulum to the omasum. Now, the way this goes is that there is a canal, if you will, or a tunnel between the reticulum and the omasum. This canal or this tunnel is basically contract, and when contraction takes place, the lumen widens in this canal when it twists. Basically, the contraction is not an actual contraction where the size shrinks. No, it actually twists so that it accommodates more food coming from the reticulum, and that's when the food from the reticulum gets into the omasum, where it gets between the leaves of the omasum and start deceiving effect there. Now, with this canal, especially in the newborn animal, this makes bypassing the milk from the esophagus all the way to the omasum through the reticulum and then the omasum and then the abomasum easier compared to regular food when it passes from the esophagus to the rumen and then to the reticulum and omasum. So in the newborn, you have to know that the milk bypasses the rumen through the action of this opening, and it's basically connected to a structure in the reticulum that's called the reticular or esophageal groove, which basically allows the milk to go all the way to the omasum and then to the abomasum directly. Okay, so what happened with the omasal contraction then? When the reticulum contracts, the orifice of the abomasum or the opening of the omasum dilates, opens up, and it dilates. That's when the sieving effect takes place. So the smaller particles, the 1 millimeter or less particle, will go into the leaves. The rest will remain in the reticulum until the size of it gets even smaller and smaller to become 1 millimeter or even less. After the food gets between or into the omasum through the omasal orifice, the canal contracts. When it contracts, it pushes the food, forces it between the leaves. That's when the leaves starts absorbing the volatile fatty acids coming from the rumen and also the bicarbonates. You do not want any volatile fatty acids or bicarbonate to get into the abomasum because of the pH of these molecules. If they get there, the digestion process ceases or gets delayed. After that, omasum contracts and food enters the abomasum. Abomasum is the enzymatic digestion. Enzymatic digestion, just like the stomach of the equine or in the canine or the feline, and it's pH sensitive. So we don't want to get any high pH there. Why? Because in the enzymatic digestion we have pepsins or pepsinogens that are converted into pepsins by a very low pH, like 2.3. So we don't want to damage that by getting higher pH into the abomasum from the volatile fatty acids, or even worse, from the bicarbs, because bicarbs are alkaline, and the pH of the bicarbs is alkalytic, so which means it's above 7. And so you don't want to get it into the abomasum. The same thing with the pH of volatile fatty acids. It's 6 and above, 6.5. So we don't want that to happen. And that's where the most important thing for the newborn, calves or lambs comes. I mentioned that um, in the newborns, usually to for the newborn to get used to the adult diet, part of the newborn's diet gets into the rumen. About 10% is lost in the rumen, and that will stimulate opening of the rumen to start the uh, I want to call it the adult digestion process. But in general, the milk bypasses the rumen, as I mentioned earlier, and ends directly in the abomasum. Remember about the groove that I mentioned in the reticulum. It's called the esophageal groove, which basically allows shutting of the omasum and going of the material all the way from the esophagus to the abomasum, just like in other animals like horses and dogs and cats, where the food gets from the esophagus to the stomach directly. Here, this is what the groove does basically in the newborn. And also we have to mention that this is vagally stimulated. So stimulating the vagus basically, or this process happen or occur under the vagal stimulation. So when the vagus is stimulated, you have the groove opening, and basically the adult life starts. So all of this happen, within weeks to months, until the newborn starts on the adult diet. Also, from a medical standpoint, the antidiuretics, the medications basically shorten the canal that I talked about in the omasum, and twists it. So basically, again, you can bypass it with these medications. So now we reached the end of the motility patterns in the ruminants. Very straightforward. maybe lots of steps, but very straightforward. 2 cycles. The first one is reticulo-ruminal, and the second one is abomasal. The first one is primary and secondary. The primary is mixing, and the secondary is eructation or rumination. Um, the rest is basically the same, and now uh, also in the small intestines and the large intestine are the same as in other animals where you have the MMCs or migrating complex. And now after this, I would like to talk about a number of clinical cases in in um, in ruminants. So the clinical cases in ruminants are very common if you practice large animal medicine and surgery, um, and they're summarized here. Here are a number of clinical cases that I would like to talk about. Bloat or bloating, I did talk about it before, and it's there's a lot of gases and volatile fatty acids that accumulate in the rumen, which is pretty bad and causes metabolic acidosis, and sometimes you lose the animal if not treated. And I'll show you how to treat them. Traumatic reticulo-pericarditis or TRP, another name for the disease is hardware disease, where you have a nail or wires that are puncturing, between the reticulum and all the way to the pericardium of the heart, and this will basically um, uh, decrease the motility pattern of the rumen, leading to increased in the slurry zone and omasal transport failure. So the food stays in the rumen, and that's again pretty bad because the bacteria, when the food does not go through rumination and then does not go to the omasum and the abomasum, the bacteria continues, or the protozoa, the bacteria, and the rest of the microorganisms in the rumen continue to ferment the food, with that producing lots of gases and lots of volatile fatty acids, and that's when it reaches a point above what's needed, it becomes a disease. It becomes bad, and that's when you need to treat the animal, or sometimes you lose the animal. Vagal indigestion, again, it's one of those cases where you have trauma to the vagal innervation of the rumen, and usually this happens through enlargement of lymph nodes that located near the vagus nerve, especially in sheep. When you have caseous lymphadenitis, you have tracheobronchial lymph nodes that are enlarged with pus and swelling, and they basically put pressure on the vagus nerve, leading to indigestion, which again also will lead to accumulation of gases and also accumulation of volatile fatty acids. Another case is left dorsal displacement of the abomasum and right dorsal displacement of the abomasum. As I mentioned earlier in the very first part of the previous lecture, is that the abomasum is the where the enzymatic digestion takes place. It's the glandular stomach, and it's located in the ventral right hand side of the abdominal cavity of the rumen of the sheep and cow, the ruminants basically, and the left in the ventral right side of the abdominal cavity. And so sometimes it goes on the left hand side, it migrates to the left hand side, and sometimes it goes to the dorsal right hand side. So it's located ventrally on the right hand side. It goes all the way to the dorsal aspect of the abdominal cavity on the right hand side. Again, both of these cases cause what we call hypomotility, basically inhibition of the motility patterns and gas production, as the other cases as well. Sometimes we utilize cows, especially to be donor cows. Donor cows mean uh, that we need their microflora to for other cows who are not, who are having problems digesting their food. And so what we do is we create a fistula in these active animals, and we take some of their ingesta along with the microflora to the other cows to stimulate basically their microflora to start working. So in the next few slides, what I will do is I'm going to show you a number of these cases, just to remind you of the importance of bovine medicine and surgery, and understanding the motility pattern of the stomach in ruminants. So this is a picture that's showing a cow. We're looking from the back of the cow, and to see and appreciate the left-hand side of the abdominal wall compared to the right-hand side of the abdominal wall. And here the accumulation of gases is pretty clear. The cow is pretty uncomfortable. The motility patterns are diminished. The microflora continue to ferment and produce more and more gases, which will become even more and more devastating for the animal. And the way we treat that is basically to create an opening with a tool that's called trocar and cannula. So basically what we do, this is the trocar and the cannula. We put them together like a sword and a sleeve, and then we puncture the left paralumbar fossa of the abdominal wall in the affected cow, as shown in B here. In B, you can see the cannula inside the wall, and then of course we leave it there so the gas can have some way to escape from there. But because the trocar is pretty long, when we puncture, we don't only puncture just the abdominal wall, but also we puncture the wall of the rumen. So that's when we puncture it. We leave the sleeve there, the cannula basically, and so the air or the gas starts to go in, and the animal is relieved. Now, the second case is the traumatic reticulo-pericarditis, or TRP, or hardware disease. The most important thing to see here is the relation between the heart, the pericardium, and the reticulum. And on the top right hand side of the cow in the picture, you see a bucket that is full with nails, full of nails. These nails were taken from a cow that actually ingested food that contain these nails and wires, and they are located in the reticulum. Now the problem is when the nail punctures the wall of the reticulum, it goes straight to the pericardium and cause pericarditis. Reticulo-Pericarditis. Now, this is pretty bad because you have inflammation of the heart, and which can lead to severe edema and heart failure and then death of the animal. This is a cow that shows an arched back. Usually when the cow is having a hardware disease, it's very difficult for them to relax and breathe normally, because every time they breathe, they push the nail straight to the heart, straight to the pericardium, and then straight to the heart. And this is pretty painful. And so what they do is they keep an arched back position, an arched back position. Also to make themselves more comfortable, at least. In addition to that, you have loss of fluids, which will cause edema. This is edema, accumulation of fluids subcutaneously underneath the skin. There's a lot of fluids. In addition to that, you have abducted elbows. Abducted elbows. Again, the reason why the animal is doing this posture is to make themselves more comfortable, because the normal position will basically create a painful situation for them, because it keeps the nail pressing on the pericardium. Now, the way to treat it is with a surgical procedure that's called rumenotomy, opening of the rumen. Of course, since the rumen is located on the left-hand side of the animal, the surgery is going to be done on the left-hand side of the animal, and the green straight line on the left paralumbar fossa is basically where the incision is going to be done to open the abdominal wall and then the rumen. And the type of anesthesia is, we call that an inverted L shape, local anesthesia. So it's just underneath the skin. We put the anesthetic material or the anesthetic solution underneath the skin in an inverted L shape, and then we open where the green line is showing. Of course, we put a rectal sleeve, a very long sleeve that reaches the shoulder, and we start cleaning all the abdominal, all the ruminal contents until we reach the reticulum and try and get all the nails out. Nowadays, they use a magnet and to reduce these cases significantly, basically. Another thing we can utilize rumenotomy for is the Rumen board. The Rumen board, as I mentioned, we can utilize it to basically get microflora from active cows. When I say active, I mean their digestion process is pretty good and they're pretty healthy cows, and they gain weight pretty well, and all of the good characteristics in a producing animal. So we try to take some of their microflora to some I hate to use this term, but I'm going to use it anyway, to a lazy digesting animal. So the microflora here will stimulate the microflora there to basically be more active. This is basically how we take it. We put a tube and a pump, and then we take some of the microflora from the donor cow and so on. Now let's go to the left displacement of the abomasum. LDA and RDA. I mentioned that the rumen occupies the left-hand side of the abdominal cavity in ruminants, whereas on the right-hand side of the abdominal cavity you have the reticulum, omasum, and abomasum. And the left picture shows the normal positioning. In the right picture, however, you will see that the abomasum, which was on the right-hand side in the ventral aspect of the abdominal cavity on the right-hand side, it moved to the left-hand side. That's left displacement of the abomasum. So what the surgeon does is basically place the opens the abdominal wall and places the abomasum back into its normal position with a suture material with a very strong 1 or 2 stitches that he places between the abomasum and the abdominal wall to basically keep it from moving into the left hand side. Wants to keep it on the right hand side. The next case is the right displacement of the abomasum. We looked and we saw the left hand side displacement, where you've seen in the previous picture. This is another picture that shows the abomasum again on the left hand side compared to the normal on the left hand side picture. There is no abomasum, there is no purple structure underneath the spleen attached to the wall of the rumen. On the right hand side picture, on the other hand, there is a purple structure underneath the spleen attached to the wall of the rumen, and that is the abomasum. That's an LDA, or left displacement of the abomasum. Again, the surgeon moves, opens the abdominal wall, moves it to the right hand side, and keeps it attached with the abdominal wall on the right hand side. The next is the right displacement. This is the right displacement. Again, I mentioned that the abomasum, and as shown in the left-hand side picture, is located on the right-hand side on the abdominal wall ventrally. Sometimes it moves above the omasum, again on the right-hand side. It displaces itself. It migrates. It moves to the dorsal aspect of the abdominal cavity on the right hand side. Again, the surgeon, what he or she does is they pull it back and they tag it to the abdominal wall, so it will not move. This is basically the end of the ruminal motility patterns. The ruminal motility patterns. We have again a primary and a secondary, and we have 2 cycles. And the most important thing is that the first cycle separates the food based on the size, whereas the second cycle separates the food based on specific gravity and contraction. There are a number of clinical cases which are very important. In the next lecture, I will be talking about a different topic, and that will be gastrointestinal secretions. Gastrointestinal secretions, which is basically the second special function of the gastrointestinal tract. We've talked about the first one, which is motility. Next time we will start secretion.